Next from Alex. How can you convince the unvaccinated to get vaccinated? How do you shift the psychology?
Alex, thanks for this question. Look, the psychology and about vaccines, it's not new. We have seen it when first polio was discovered in the state. We have seen it after the measles, mumps and rubella vaccine, and there was always people who didn't believe in the science. Yes, in the 50s and 60s, we made some mistakes. Quality control wasn't as rigorous as what it is now. And at the same time, unfortunately, production of the vaccine was not as rigid as what it is right now. But we have advanced. We're not doing actually vaccine in the same equipment that we did in the 50s and 60s. And our scientists have advanced. Our production has advanced. We as a humanity, as a human being, we have changed, gotten better from the 50s, 60s. What we produce the vaccines now, we actually eliminate any risk in the production's lines. Now, anti-vaccines were present then, or antivaxxers, and they are present now. Unfortunately, those anti-vaxxers knows more, unfortunately, those anti-vaxxers pretend that they know more about the vaccines than the scientists, and that is wrong. Our scientists, they know a lot more about the disease first, how deadly it is, and they know the data about the vaccine. And if it was recommended by the scientist, then you take the words of the scientist. If the anti-vaxxers, and they are actually painters, mechanics, or workers, or a pseudo-scientist, all right, and they're making these assumptions, we're not going to listen to them. The data is there to prove that these vaccines work. And the mortality rate of this virus is very high. How to change the psychology is by giving them facts, by giving them numbers, by letting them know about the disease much more what they know about the side effect of the vaccine. They're magnifying the issues. Yet, we need to hear them. We need to listen to them. We need to give them our data. Now, I might not be the best person to convince them, but I have seen it in the field. I have seen people who got COVID-19 before vaccination and they died, and they're very close to me. And I have seen people who've been vaccinated, they contracted the Delta variant, they contracted the Omicron variant, and how it's affected them and how they pulled through. When someone is sick, we take them to the hospital, to the ICU. And the people in the hospital and the ICU who are caring for your loved one are telling you and telling me, vaccinate them. Because they know much more about the disease, they know much more about the vaccine. Yet, those who don't believe in the science, they will keep propagating their view. We respect their view, but their view sometimes, and right now, it's a deadly view. Because if there's someone who is vulnerable, who actually keep listening to them and don't get vaccinated, unfortunately, they're not doing them any favors, because clinically we know they're not doing them any favors. Yet, they exist, but in Australia we are lucky. They are a minority, because people approved the scientists and approved the science opinion by lifting up their sleeve and getting the injection. And 93% of Australians have received 2 vaccinations. Now that should let all these anti-vaxxers head the fact that 93% of Australians have approved of this vaccine, and they have had it and with minimum side effects. The rest who don't have it, it is their choice.